All right, okay. So we are live now. So, good morning, everyone. A very warm welcome to all of you present here. Thank you so much for joining us today on a Sunday morning. Today's session, we have two speakers with us. Our first speaker will be Dr. Suja Ajoy Kumar, and our second speaker will be Dr. Neil Pinto. Both of them will be speaking one after the other. So before we begin, I would like to just tell you a few ground rules. First of all, if when we ask any questions, please do use the YouTube comment section to respond to our questions. And if you have any doubts during the session, then don't hesitate to ask on the YouTube chat section. And in case you are facing any difficulties with respect to the link or joining in, or any other difficulties, please use the WhatsApp group. I would like to remind you that the certificates are only for SIMSA members. However, non-SIMSA members can also attend the session for sure. At the end of the session, we will be posting a post-event questionnaire and also a feedback form. The post-event questionnaire is if you want to receive the certificate and also for our evaluation. And the feedback form will be completely anonymous. I promise it won't take you more than 2 minutes to fill it in. All right. So our first speaker for today is Dr. Suja Ajoy Kumar. She is an alumnus of Thrissur Medical College. She was a Kerala University topper in MD Pathology in 2002. She also has a DNB in pathology in 2005. Ma'am has had 15 years of experience working in the Department of Pathology in KIMS. She is currently in charge of the blood bank at KIMS. She strives towards excellence in transfusion medicine and is also heading several research projects in transfusion medicine. Thank you so much for joining us, ma'am. So, without any further ado, if you would like to begin presenting, that would be great.
Hello. Good morning, all of you. At the outset, let me thank SIMSA for giving me this opportunity to talk about plasma donation and plasma therapy. And a special mention to Swati, who has been coordinating this event very well. She has been updating me and coordinating with me. Thanks, Swati. Thanks a lot. It has been great. And I think I'll start with the presentation. Okay. So today we'll be talking about plasma donation and a special mention about plasma therapy. Plasma therapy has been in the limelight of late because of the COVID pandemic, where it is supposed to be one of the treatment modalities in the absence of a vaccine and specific therapy directed against COVID-19. So what is plasma and what are the prerequisites for plasma donation? How do you go about that, and what is plasma therapy? So we'll be talking about all this now. So before we begin, a small question for you. There are three fluids here. There are pictures of three fluids here. So would you be able to identify which of the following is plasma in this? Question is open.
All right. We have Altaf Hussain Mohammed saying it is A.
Yes, great. Shall I proceed?
Yes. There are many people who are saying it's A. Okay, most great. Of the students are saying it is A.
Yes, that's right. Very much right. The fluid that you see, the straw colored clear fluid that you see in the bag in the figure A, that is plasma. In C, what you see in the bag is the blood cells, red blood cells, and B is urine sample, which is in the urine bag. So let us move on to, that's the answer. The straw colored fluid that you see there is plasma. So what is plasma? Basically, let's find out what is plasma. So, blood which is flowing in the blood vessels is composed of the formed elements, that is the cells, the red blood cells, the platelets, and the plasma, which is and the white blood cells, sorry, which is suspended in the fluid medium, that is in the fluid medium. Now, what happens when blood comes out of the blood vessels? You all know it clots immediately. So if you take blood in a test tube, leave it undisturbed for some time, the blood will clot. The clot will be at the bottom, all the cells will be trapped in the clot, and what the fluid that is expressed on the top is called as serum. For many of our investigations, we use anticoagulants to prevent the blood from clotting. We can do the test in the blood only if it is in the anticoagulate state. So we add anticoagulants to the blood to prevent it from clotting. So what happens when you take blood to which anticoagulant has been added? This is centrifuged. When we centrifuge blood to anticoagulated blood, we can see that the cells will settle in the bottom, and the clear stroke-colored fluid that is expressed above the cells is called as plasma. So this is plasma. We take anticoagulated blood and centrifuge it, we get plasma, which is separated at the top. So this contains all the clotting factors because it is not coagulated as such. So the main importance of plasma is that it contains all the clotting factors. So serum is plasma minus the clotting factors, whereas plasma contains all the clotting factors. So what are the basic components of plasma? Majority of it is water, up to 95% by volume is water. The next major things which are present are the plasma proteins. We must be knowing the plasma proteins are albumin, globulin, etc. Then it has inorganic salts, the nutrients, hormones, enzymes, and this other secretions which are present. So what are the uses of plasma? So once we have separated the plasma, it can be used as a volume replacement agent. That is one of the uses of plasma. The next major use is because of the plasma proteins that it contains. The proteins which are present in the plasma, as we said, the albumin, globulin, and the coagulation factors. These are all the major components there which can be used. Now, albumin, once we separate the plasma, if it is frozen immediately, we do rapid freezing, then it will preserve all the coagulation factors. So it's a rich source of the coagulation factors, and this can be used for treatment of bleeding disorders and in liver diseases where we need to replenish the clotting factors. Again, albumin, which is present in the plasma, can be used for treatment of treatment cases where there is protein loss happening, like in burns, in shock, etc. And the immunoglobulins can be used in primary immunodeficiency diseases to replace the immunoglobulins. Now, plasma collected from several people can be pooled together, and this can be subjected to fractionation and extraction. So we can do fractionation of the plasma. It is pooled from several different donors. This is fractionated, and the different proteins can be separated. So we can manufacture albumin, globulin, etc. from this. And this can be used for the treatment of these disorders. So these are the major uses of plasma. Now, before we move on, how do we extract the plasma, how it is separated? So this is a machine which is used for the same. Could someone just guess what is the name of this machine? This is a machine that is used for separation of plasma. What is the name?
All right, we are waiting for the responses. Guys, do not hesitate to
yes, please.
Comment. Even if it is wrong, it's perfectly all right. Okay, we have people saying it's a centrifuge and it is an apheresis machine.
Great. Yes, it is an apheresis
centrifuge.
Yeah, it is. It uses the principle of centrifugation, so it's almost right. Yes, it's a machine which centrifuges the blood, so it's called as a apheresis machine. So moving on, how do you collect plasma from the donor? This is a process collected through a process called as plasmapheresis. It comes from the Greek word apheresis, meaning to withdraw. So this is an apheresis machine, and the procedure is plasmapheresis, where you separate plasma from the donor. In this procedure, you collect blood from an arm vein, and this is sent into the machine where it undergoes centrifugation. The plasma is separated, and the red blood cells, the blood cells and the platelets are sent back to the donor. So about 500 ml of plasma is collected in the anticoagulant solution, that is the acid citrate dextrose or buffered citrate solution that we are using in the machine. So the blood mixes with the anticoagulant, goes into the machine, it is centrifuged there, the plasma is separated, and the rest of it is given back to the donor along with some saline. So this is a procedure how we collect plasma. Now this is our apheresis machine which we have in KIMS blood bank. So what are the criteria? Who all can donate plasma? So individuals above 18 years of age who weigh more than 45 kgs. And another major prerequisite is they should be ABO and RH group compatible with the recipient. And before we start the donation, we need to do pre-donation screening, very essential. All donors have to be screened first. So what are the essential screening tests that they have to undergo? That's a complete blood count to see whether everything is fine, the cells and the counts are all fine. And next major thing is the testing for transfusion transmissible diseases. These are diseases which can be transmitted by blood, like HIV, HBsAg, HCV, syphilis, and malaria. So these are the essential screening tests that the donor has to undergo. So once all this is cleared, they can donate the plasma. Now, usually there is no adverse reactions of donation. Very rarely, if the patient has eaten well and he has rested well, usually there are no adverse reactions by donation. What care should be taken by the donor after he donates? Should drink plenty of fluids to replenish the lost fluid and eat a healthy meal within 2 hours of the visit. No smoking for about 30 minutes after the donation. And you should avoid heavy weightlifting and strenuous activity for at least 24 hours. So as I said, otherwise, usually there are no adverse effects of donation of blood or other components. What happens once a plasma is collected? This plasma is rapidly frozen and then it is stored at minus 30 degrees centigrade. The shelf life is around about 1 year. So once we do the rapid freezing, all the plasma proteins, the coagulation factors will be well preserved in the plasma. So this is how it is stored in special deep freezers. It can be stored for 1 year. So once it's frozen, how do you issue it? So there's a request coming in for the plasma. Before issue, it has to be thawed at 37 degrees centigrade. So we have special water baths at 37 degrees centigrade. It is thawed and made into the liquid form. And once it is thawed and issued, it has to be used within 24 hours. You cannot refreeze it. So always remember, these are the essential things that have to happen. So the request comes to the blood bank. When we have to issue it, we'll thaw it after everything is matched, like ABO, RH group matching and all is done. And then it is thawed and then issued. So documentation is very important here. So here we'll have a small video summarizing what all has been told till now. Let's go through that.
Ma'am, I think you will have to share the screen for the video because the video is not playing right now.
Sorry.
The video is not playing. I think you'll have to share the screen of the video.
Okay, one second. Okay, where does that option come? Sorry, one second.
Ma'am, in the Zoom link, there will be an option to share screen. So you will have to stop sharing and start sharing the screen where the video is being played.
Okay. Just a second. Okay. So that was a video which summarized whatever I have been telling. This is why the donation matters, because as it was said, for pooling the plasma and manufacturing albumin and globulin for treatment of these patients, you need to have so many donations. So each and every donation matters. Before you move on to the second part of the talk, here is a small jumble which you can unscramble, which gives a clue of what we'll be talking about next. Any takers?
Ma'am, I think the participants will be requiring a little more time for this question. So
Okay,
let's
no
give them
issues.
about
Yes.
2 minutes.
Done.
Okay, to give you a hint, this is related to today's topic. It's nothing outside today's topic. Okay, we already have many correct answers. Many people are saying it is convalescence.
Great, that's great. Yes, this is convalescence, and we'll be moving on to the next part. We'll be talking about convalescent plasma, which is in the limelight nowadays. So what is convalescence? Convalescence is a period in which body recovers from a serious illness or injury or a surgery. So the patient's blood during convalescence is highly rich in antibodies, which help in the recovery process. So how do we make use of this? Now, convalescent plasma therapy is also called as passive antibody therapy. We all know there are two types of immunity, the active immunity and the passive immunity. Active immunity is when the body manufactures the antibodies. Passive immunity when it is directly given to the patient. So this is passive antibody therapy. And this was identified in the year 1898 by the Nobel laureate and German physiologist Emil von Behring. And he demonstrated that injections from an animal with tetanus could confer immunity to the disease in other animals. So this was a major finding from him. And convalescent plasma since then has been used to treat several bacterial and viral infections. As we all know, it has been used in the H1N1 influenza and SARS and Ebola virus pandemics in the past. How does convalescent plasma help? So it's usually obtained from donation from a convalescent person. And as we said, it contains a specific antibodies or immunoglobulins against the infectious pathogen. These are called as neutralizing antibodies. How do these neutralizing antibodies act? So once a virus enters into the host, it has to enter the host cell. It cannot multiply on its own. It depends on the host cell and its machinery to multiply and produce the progenies. So it enters into the host cell and uses a cell machinery to multiply. So these antibodies which are present in the convalescent plasma will hinder the entry of the virus into the cell and the further activities that happen inside the cell. So these are called as neutralizing antibodies, which are antiviral antibodies. So they will inhibit the entry of the virus into the host cell and the further multiplication of the virus within the cell and the release of the virions. So this has been used for several diseases like rabies, hepatitis, measles, influenza, Ebola, and other hemorrhagic fevers. Another mechanism of action other than the neutralizing antibodies, we know this plasma is rich in anti-inflammatory cytokines, the clotting factors, and other natural antibodies. So once a virus has entered into the host will start the immune response. Will mount the immune response against the virus. So this immune response, all the inflammatory cells will be activated and they will release several cytokines, which will cause destruction of the virus. So in the process of destruction of the virus, the cytokines will also be destroying the host cells. They are innocent bystanders. They also get destroyed in that. So especially in COVID patients, there is something called as a cytokine storm which happens. There is a vast immune response that develops and the body gets overloaded with the cytokines. So what happens in this process, the host cells also get damaged. So this is one of the reasons for the lung damage that you see in COVID patients. And the sequelae of this heavy inflammation can lead to pulmonary damage and fibrosis later on, reducing the pulmonary capacity. So the cytokine storm is also one of the causes for the disease, for the symptoms that happen in COVID. So we need to control the cytokine storm also. So in the plasma, there are several anti-inflammatory cytokines which will reduce the cytokine actions. So these are the two major types of action of the convalescent plasma. So the convalescent plasma, again to summarize, contains the neutralizing antibodies, it contains the clotting factors, it contains anti-inflammatory cytokines. And when this is given to the recipient, the neutralizing antibodies, they have the antiviral effects which will stop the reproduction of the virus, and the immunomodulatory effects will bring down the cytokine storm and bring down the damage, the extensive damage to the host cells. Now, the patients who recover from COVID-19 illness usually develop the circulating antibodies within 2 to 3 weeks following the infection. And these can be detected by ELISA or other quantitative assays. So you need a time gap of at least 2 to 3 weeks by the time the immunoglobulins will be formed. And these are protective antibodies. There are several studies which have shown that this will confer immunity till around 2 weeks to months later. They cannot be reinfected. And these convalescent plasmas, which usually have those which are having high antibody titers. So we need to do the antibody titers, and this should be given early prior to the patient developing severe complications or inflammatory, life-threatening inflammatory end organ failure. So who are the people? So first of all, let's see who are eligible for donating plasma, for convalescent plasma donation. Again, individuals more than 18 years of age. Usually we prefer males or nulliparous females weighing more than 55 kg. Why nulliparous females? Once in pregnancy, the females get exposed to a lot of antigens from the fetus. So the antigens will be antibodies and will be more. And as we said, the plasma has already got lots of antibodies. So there is a chance of reactions happening. So we prefer nulliparous females and males weighing more than 55 kg. There should be a prior diagnosis of COVID-19 documented by RT-PCR with symptomatic disease with at least cough and fever. Why symptomatic? Again, it is found that the immunoglobulin response is more in patients who have had symptoms. So we'll prefer patients who are symptomatic with at least cough and fever. There should be complete resolution of symptoms at least 28 days prior to donation. As we said, there is a time limit for the immunoglobulins to develop from 2 to 3 weeks. So we prefer to wait for at least 28 days. Or there will be complete resolution of symptoms at least 14 days prior to the donation, and 2 negative RT-PCR for COVID-19 swab 24 hours apart. These are the criteria, essential criteria for convalescent plasma donation. Donor can donate around twice a month, not more than that. Also, the additional donor eligibility criteria, which is taken for all the regular donors. So these are the specific ones which are for convalescent plasma donation criteria. Pre-donation screening, the routine ones, the complete blood count, ABO-RH group, very essential. Routine testing for transfusion transmissible diseases. And the specific ones for COVID is the serum proteins levels should be estimated. It should be more than 6 grams per deciliter. Also, as I said, the antibody titer has to be done. Anti-SARS-CoV IgG antibodies, that is, it should be around, the titer should be around 1:640. So once the donor is passing all these tests, he'll be eligible for donating convalescent plasma. Now, who will benefit from the convalescent plasma therapy? As already said, it has to be done before the person goes in for life-threatening end organ failure. So the patients with moderate infection who are not improving and their oxygen requirement is progressively increasing despite using steroids. These are the patients. So we should identify the patient who will benefit from the plasma therapy, and is usually well tolerated. Patients show significant increase in neutralizing antibodies and disappearance of viremia in 7 days. Clinical symptoms are shown to decrease in 3 days within plasma therapy. So again, the criteria for eligibility for plasma therapy, as I said, moderate infection. So adult individuals more than 18 years of age with confirmed RT-PCR confirmed COVID-19 disease. The PaO2 should be 200, FiO2 should be 300, respiratory rate of 24 cycles per minute. Oxygen saturation should be 93% in room air, and there should be availability of a matched donor plasma. So these are the essential criteria. So we need to identify the people who will benefit from the plasma therapy. So let us stop for some time and decide, like to think what is common in this picture. What do these people have in common in this?
So to begin thinking about this question, first, I think we need to identify what these 3 people are and try to find out what these people might have in common. So, ma'am, let's give them about a minute
Sure.
or two to answer.
Yes.
Okay, we have someone saying they are all immunocompromised individuals.
Okay. Mm-hmm. I think that you can't apply that to all, maybe. Anything further? So there's a child, there is a pregnant lady, there's a person who is already on clinical trials. So what do these people have in common?
We have someone saying they are susceptible groups, someone saying they might have antigens in common, vulnerabilities.
Okay, maybe.
Okay. We have more people who are saying they're all susceptible groups.
Yes. Okay, I think that should be fine.
Yeah, I think, yeah. So someone's identifying them as pregnant and
Yeah.
elderly parents.
Okay.
Okay.
Yeah, right. I think we'll go to that. So these are the people who cannot receive the plasma therapy. Already we have said the criteria for who can get the plasma therapy. So these are people who we cannot give the plasma therapy, that is pregnant and breastfeeding women, patients with known hypersensitivity for blood products. Because as I said, the plasma is loaded with antibodies. So people who have already been hypersensitive blood products should not be receiving this plasma. And people who have been a recipient for pooled immunoglobulin in the last 30 days, because pooled immunoglobulins, again, the plasma which we are giving them will be having lots of antibodies and antigens. So in that case, they are likely to develop reactions. And again, critically ill patients, those who have moderate to severe ARDS, that is acute respiratory deficient syndrome, patients with mean arterial pressure below 65 mm of mercury, patients with IgA deficiency, those who are having IgA deficiency will have antibodies to the immunoglobulin A, and the plasma which we give them will be containing all the immunoglobulins. So there is a chance of a severe reaction happening. Again, participants in other clinical trials, they should not be given because it will be very confusing to see the outcome. So these are the patients who cannot receive plasma therapy. So the clinician has to decide the patient who will benefit maximum from the plasma therapy. So before we give the therapy, all the standard hospital procedures have to be followed. The recommendations for thawing and transfusion, as I said, once it is thawed, it has to be used within 24 hours. It cannot be refrozen. And the documentation, the identification of the blood bag, the identification of the recipient, everything is very important to avoid major reactions happening. Crucial to ensure ABO compatibility between the donor and the recipient. Now, how much can we give the plasma therapy? Patients actually ideally should receive an initial dose of 200 ml is given. This can be followed by 1 or 2 additional doses of 200 ml depending on the severity and tolerance of the infusion. So the dosage advised is 4 to 13 ml per kg. Now it can be ideal to give 2 different donors, plasma from 2 different donors, because it will have more diverse antibodies. It can give more effective immune protection. So ideally it starts with the 200 ml. And this can be added on, more additional doses can be given, and that is again on the clinician's discretion. And meanwhile, the blood, serum or plasma samples of the recipient have to be preserved in case of any reactions for any further investigations. And the recipient should be closely monitored for several hours after transfusion for any transfusion-related adverse events. What are the adverse effects that can happen with plasma transfusion? TRALI or transfusion-related acute lung injury is one of the fatal complications that can happen. This is basically a non-cardiogenic pulmonary edema happening. This is because of, again, hypersensitivity to the white cell antigens. In this case, there is no the cardiac function is absolutely all right. but the patient presents with pulmonary edema. The central venous pressure, everything is normal, but there is pulmonary edema. This is one of the fatal complications that can happen. Next is transfusion-associated circulatory overload. This can be prevented. Allergic or anaphylactic reactions again, and transfusion-related transmission of infection. So these can be prevented if the proper documentation and proper care is taken. The physician has to be alert for all these reactions that can happen with plasma therapy. Now that is regarding the basics of plasma therapy. Further, there is a search happening for purifying concentrated neutralizing antibodies from high titer convalescent plasma that is called as hyperimmunoglobulins. So work is going on in this field, and also to manufacture monoclonal antibodies which are active against the specific SARS-CoV-2 targets. Also, the convalescent plasma therapy is a strategy of passive immunization for the management of moderately severe cases in the present state, as there is as yet no vaccine. Vaccines trials are also going on. So once the vaccines come, till that time, this is one of the treatment modalities that can be used for moderately severe cases. And there are several studies which are for and against plasma therapy, but still the further investigations are needed for this to come to a conclusion. And it has to be used in a proper manner and with the proper guidelines for best results. As I already said, the criteria have to be met, and all the documentation, everything should be done. The donors should be available. First of all, the most important is donors should be available. Plasma donation, convalescent donors should be available for donating the plasma. So these are the basic prerequisites. And finally, blood donation. I would like to stress again, blood has no substitute, as we all know. So it is very important. I would like to stress again on voluntary blood donation. Once you give blood, you can save so many lives. So it is very important. Each one of us should come forward in this aspect. I think that's all in my talk. I hope it was useful regarding plasma therapy. I'd like to take any questions.
All right. Thank you so much, ma'am. I think we have time for taking a few questions. So we already have a few questions pouring into the comments. We have someone who's asking, why should smoking be avoided within 30 minutes of donation?
Now, all this can alter the factors. One second, let me just, One second. Yeah.
So the question was, why should we avoid smoking within 30 minutes of donation?
Now, there are several prerequisites. The plasma can be affected, whatever, the blood can be affected. So these are all like medicines. There are several medicines which are like we should not be taking when we donate plasma. So again, in that, we need to avoid the smoking for that.
All right. So, ma'am, what are some of the drugs that we need to look out for during screening?
During screening is not done. We usually take the history from the donor. We don't do screen for the drugs as such. We take a detailed questionnaire in which we ask them whether they have been taking any medications or they are having any chronic diseases. We don't screen for them. Screening is basically done only for the transfusion transmissible infections.
So another question is, if due to the antibodies, infection, okay, I think what they're trying to say is, if due to the antibody, if infection can't recur, then how is it that people get reinfected with COVID?
Sorry, I didn't get you.
I think what they're trying to say is, due to the antibodies, if the infection cannot appear again, then how do people get reinfected with COVID?
There is another thing which can happen. There are different strains of the coronavirus which can come in. So it need not be the same strain that you get infected again with. The antibodies will be for the specific strain of the corona which you have been infected with. So if there is another strain which is coming in, that's also a lot of studies are going on regarding that. So if you get infected with, you're all likely to get infected with another strain for which you may not be immunized. So that can happen.
So we have in ARDS patients, won't cytokines reduce if plasma therapy is given, and thus this should reduce the lung inflammation?
No, ARDS, already there is a lot of damage which has happened. So in that case, reducing the cytokines may not help in that way. The cells have already been damaged. So you should hit them before the cell damage occurs. So once it goes in for the organ failure, it is a state where we cannot recall them back. So cells have already been damaged. That is why we say it is in moderately severe patients whom we should start the therapy before there is massive cell damage happening.
All right. Ma'am, could you explain the dosage of plasma again?
It's around 4 to 13 ml per kg. That is what is recommended. So you start with the initial dose of 200 ml, and then further doses can be given depending on the patient's response and the need for further donations, further transfusions.
Ma'am, why should we wait for 60 days before pooling of plasma?
Okay, that actually, I don't know, it was there in the video, but it's actually, there's nothing like a 60 days maybe. What we do usually, they take the plasma, anytime they can take it, and it's already frozen, it's kept in the freezer. The life is around 1 year. In that time, we can give it, they can pool it and prepare the plasma proteins.
Ma'am, why shouldn't plasma therapy be given to people with low mean arterial pressure?
Okay, that's again coming to the end stage. The people are already in the end stage where there is a lot of reduction in the lung capacity. So the arterial pressure is already low. So it identifies a person again as going in for an organ failure. So it's the same criteria. That's why the criteria, the clinician has to depend on these values to decide what category the patient is in.
Ma'am, can a person donate only plasma again if he did blood donation 1 month before?
Yeah, he can. In the plasmapheresis, it can be done. Yes, because we take the plasma and we give back the other elements we can do.
Okay. Can 70-year-old COVID recovered patients donate plasma?
No.
Ma'am, why is there a high doubt with respect to use of plasma initially?
Yeah, again, it's like there are several trials going on. There are several studies going on. It all depends on individual response, yes, and also on the clinician's acumen. Clinician has to decide like who will benefit depending on these criteria. But even with all this, maybe some patients will not be benefiting with the plasma therapy. So that's why there is a lot of doubt. Several studies have said for, several are against it. So still, it's not clear how much a patient can benefit with this.
All right. Ma'am, there are several more questions, but I think we'll take them in the end. We will have Dr. Neil Pinto speaking now.
Yeah.
Okay, so I will introduce him first. So, yeah, Dr. Neil Pinto, he is a doctor by training, and he has graduated from the prestigious Sean Hospital in Mumbai. Apologize if I have pronounced the name wrong. However, his passion lies in using his medical knowledge and skills to positively impact the healthcare industry at large. He's currently working as a product manager at Glenmark Pharmaceuticals and was able to spearhead a product launch of FabiFlu or Favipiravir, a novel drug for the treatment of COVID-19. He is also the founder of PINT, Plasma in Need for Transfusion, which is an online platform that helps patients in need of convalescent plasma. It helps you find and match with plasma donors quicker and more efficiently. He's been able to successfully help patients from all across India to find and match with suitable donors. And he is dedicated to he is dedicated to solving the challenges and problems in the Indian healthcare industry. Okay, thank you so much for joining us today. And I think he has, a presentation prepared for us today.
Thank you so much. Thank you so much. Before I begin, I'd just love to take a minute to thank the entire SIMSA team for carrying out this wonderful event. I think it was much needed given the current scenario that we're facing in India with the COVID-19 cases doubling and the need for plasma therapy. So thank you to the entire SIMSA team for having me and for organizing this. Also would like to thank Dr. Suja. That was a wonderful presentation, I think covering the key aspects of plasma and very well summarized in general. So that was great. I'm just going to quickly share my screen so we can go through the deck that I prepared. Yeah, is it visible?
Yeah, it's visible.
Yeah. The organization that I've started earlier on in the lockdown, about a month or two ago, is called PINT, which stands for Plasma in Need for Transfusion. We are simply an online platform helping COVID-19 patients in need of plasma therapy find and match with donors. So we actually built a website 2 months back. This is just the interface of the website. Our motto is just to build a network of plasma across India for the recovery of COVID-19 patients. As we came across in the presentation earlier, single plasma donation can save up to 2 lives, which is kind of really effective to kind of solve this disease. Just the background scenario of why we decided to start this organization and this platform. So as we all know, there's a growing need for convalescent plasma in hospitalized patients across India. In March, when the disease began, we didn't have that many cases, and also simultaneously, there was not much known on plasma therapy. We are still kind of adapting to the changes in the scenario. But as months grew by, a lot of governments began setting up plasma banks. There were many more clinical trials done on plasma. Our cases increased, the healthcare facilities were burdened. So we needed every kind of opportunity to treat this disease, and plasma therapy was one of the forefronts in the treatment modalities. So there is a growing need for convalescent plasma. Secondly, is with the cases doubling every 20 days, there is a huge imbalance in the numbers of people coming forward to donate plasma. Currently in India, less than 0.1% of the recovered COVID population have come forward to donate, which are alarming numbers given that we almost have 6 million cases now and less than 60,000, less than 10,000 donors coming forward. So that creates a huge imbalance in our ability to meet the need for plasma therapy in COVID patients. Thirdly, is there's a lot of fear and stigma surrounding plasma donation. By that, I mean people affected with COVID. Many of the people who've recovered from COVID don't want other people to know that they have COVID. That's the kind of stigma that surrounds COVID-19. As well as people have the fear that going back to a hospital, they might get exposed to a reinfection, or they kind of, might be exposed to a weaker immunity in some sense. So there's a lot of fear and stigma surrounding plasma donation in general, which has kind of inhibited the ability for people to come forward and donate. Next is coming to the families of patients. Now, this is something that all of us have personally experienced. Families of patients like frantically send out WhatsApp forwards and calls regarding their relatives in need of plasma. They sort of seem very helpless and hopeless in this situation because it's so hard to find another recovered COVID patient to come forward and donate. So they've been, circulating messages on WhatsApp, calling people, and it becomes really difficult and challenging for the families to find a single plasma donor. So what we realized was it was taking about 4 to 5 days for a family to find a single plasma donor. And by the time they did, the patient's condition had already drastically worsened. So we realized this was a very challenging problem at large. And given that the families of patients go through so much stress and anxiety in general, to find a donor is just adding to that stress and anxiety. So that was something that really concerned us, and there was a problem we thought we could address. So coming to what we do, we at PINT are an online platform. So we enable patients to find and match with plasma donors quicker and more efficiently. We have a simple user interface where donors and patients both register on our platform. And as soon as we identify a patient in need and we have a donor in the same city and the similar blood group, we immediately match them, and they can connect and the donor can go donate. Secondly, is we try to reduce the time taken for the family to find a donor to maybe 1 or 2 days, that is 24 to 48 hours. This is most essential as this is the time that will actually help the patient as compared to 4 to 5 days that has been usually taken before to find a donor. Thirdly is we ease the process of donation by answering all the donor queries as to where they should donate, how they should donate. There's a lot of misinformation, and because plasma therapy is a new procedure, they don't know which hospital to go to, and they don't know the process of donation. Unlike blood donation, plasma donation, the machine is different. Not all hospitals are doing it currently, so there's a lot of uncertainty in a donor's mind, which we're able to kind of address. Last is we've built a community of awareness amongst our dedicated users on social media platforms, as well as the people who come to the platform and register. We have pages on Facebook, Instagram, Twitter, where we reach out to people. And this has kind of helped make COVID survivors to feel like warriors and kind of feel special and empowered in a way, and not like victims. Rather, we want to make them feel like superheroes or warriors who actually helped another patient after recovering. Sorry. So just to give a brief about how we work. So the first step in our process is the registration. So this is fairly simple. If you're a donor who's willing to donate, or if a patient is in need, they simply go to the website, that is www.pintnetwork.com, and they fill in their contact details, their location, their blood group, as well as their medical history, which is important so we can identify a match. Second, coming to the matching process, now we match patients and donors based on criteria provided by medical experts. As mentioned as by Dr. Suja in the presentation earlier, there are a lot of criteria like being a nulliparous woman or being 28 days from recovery from your symptoms. So based on these criteria, based on the location of the patient and donor, based on the blood group, we match them. And once we match them, we come to the third process of connection. When we match them, both the donor and patient get a text message as well as an email with the details of both. That is, the donor gets the patient details, the patient gets the donor details, and that enables them to kind of connect and take the process forward. Also, it creates that kind of human bond, because a lot of times what we've experienced personally is that donors always want to know and always prefer when they know the patient they're donating to. As compared to blood donation, where you donate and you don't know who your blood is going to, plasma creates that kind of human touch, and donors love to actually know the patient they're helping out and kind of be in touch with the patient even after they've received plasma. So that's just a bit about the connection process. So this is just a snapshot of the donor as well as the patient form. On the left, we have the donor form, where you can see that we need the blood group, the city, the location, things like, has the donor ever been pregnant? Does she suffer from anemia or low hemoglobin? Any infectious diseases like HIV, hepatitis? Was your COVID test positive? Has it been 14 days since recovery of symptoms? So we ask a few questions. Takes less than 2 minutes to fill out this form. As well as the patient form on the right, we require less information for the patient. We just kind of need to know if the patient has, which hospital the patient is in, which city the patient is in, and whether he's been prescribed plasma therapy by the doctor. This is important because many patients' families just think that the patient needs plasma therapy, even though the doctor has not recommended it. And this is a problem. It's only a therapy given on a prescription basis. So we kind of confirm if the doctors actually prescribe plasma therapy to the patient. Yeah, coming to why us and what we do differently, and why it would be effective to do it through a platform. So why PINT? That's plasma need for transfusion. So first is the centralized database and workflow. So we've kind of created this, is community and like a whole system of donors and patients to make it very methodical and centralized, in a sense that right now, as I said earlier, there's been a lot of forwards and calls. And people circulating a lot of messages. So this is just one place where a donor or a patient can go and find out how many donors are available, where he can go to donate. So it just makes it very easy for the patient to actually know more about plasma donation, as well as if he can potentially get a donor and how long it would take him to get a donor. This avoids all the anxiety that is created when patients can't find donors. Secondly, is we have a very simple registration process. As I said earlier, it takes less than 2 minutes, less than under 5 minutes to fill in both the forms. We require probably 10 to 12 questions that we need to ascertain whether you're eligible to be a donor or a patient. Thirdly is the verification of eligibility criteria. This is very important because a lot of the times, even though a patient has found a donor, the donor does not meet all the eligibility criteria as mentioned earlier. And what that happens is the donor goes to the hospital, very keen to donate, and then finds out once he already goes to the hospital that he's not allowed to donate because of X and Y criteria. So that kind of demotivates the donor. It kind of wastes time for the patient as well, because he's focused all his energy in getting that donor to the hospital. So we kind of prevent that from happening by just verifying all the eligibility criteria before the donor actually goes to the hospital and connects with the patient. Fourth is we ease the process. We answer all the donor-related queries, as I mentioned earlier, which hospital to donate to, what are some of the things you can't do before donation, like alcohol and smoking, as mentioned earlier, and in just any other queries they might have, whether it's painful, how long does the process take, etc. Fifth is we reduce the time taken. As I mentioned earlier, it takes 4 to 5 days. So we've kind of helped reduce that to a few hours, maybe 1 to 2 days max. Next is building awareness. We've been very active in reducing the fear and stigma that surrounds plasma donation and people coming forward to donate. And last is the involved community. So as I said, we have many social media outreach platforms, and we've actually been really overwhelmed and really heartwarmed by our users on these social media platforms. They're very active in actually referring recovered patients who are willing to donate, as well as sharing when they identify a patient in need. So that's been really touching to us that all the members on our platforms have been involved in the process, and everyone loves contributing to this, and it's a great cause at the end of the day. Coming to our impact. So this is our number so far. So on the left is our first 2 to 3 weeks of setting up. So you can see we built the platform in somewhere in July, and within the first 2-3 weeks, we had 80 donors, 400 patients, and we were able to help 40 patients across India find plasma donors. And this really kind of motivated us to expand our reach to the furthest corners of India and help as many patients as we can. And coming to date, so till date, we have now on the right, as you can see, we have 157 donors, 2,000 plus patients, and now successfully able to help 100 patients across India. We've been able to help patients in the 12 major cities of India, including Mumbai, Delhi, Hyderabad, and Bangalore. So these are the 4 major cities where we've had a lot of requests, a lot of donors coming forward. But we're looking to help patients in as many cities as we can. And through a collaborative approach with a wonderful organization like SIMSA and all the others, we think we can actually make a difference. Here are a few testimonials from one of our donors. He kind of sent us this message. He's from New Delhi. He is actually a CEO of the company, and he was really keen when we told him there was a patient in need. He was really keen, and he even interrupted his busy work schedule to kind of donate for a patient. And he was really overwhelmed with donating, and he felt really good at the end of the day. On the right-hand side is a patient testimonial sent by a doctor, sent by the daughter of a patient who received plasma. She drew this cute little drawing that on the right you can see, "I would like to say from the bottom of my heart, your blood donation saved my papa's life." This is something really touching and kind of makes the donor feel good at the end of the day when he receives such a token of appreciation, such a gem. We have a few more testimonials. On the left is Dr. Agni from Mumbai. This is a doctor who went to donate initially, and his antibodies didn't meet the required titer. And after 2 weeks, we called him again saying, there's a patient in need, and he went again, and luckily his titers came eligible, and he was able to donate. And despite being really scared of needles, despite being a doctor, he was really scared of needles, but he kind of enjoyed the plasma donation process, and he felt it was very enriching, and he felt great. And on the right, we have another donor from Mumbai. This is just some of the media organizations that have covered us and helped us spread awareness. We have India Today, CNBC, Midday, India TV, the Indian Express, just news platforms that kind of liked our initiative and helped us get the word across and spread awareness among COVID patients to find more donors. So we've been really thankful to be able to have that media coverage by the various media firms. These are just two posters, a few posters that we've been kind of circulating on social media platforms. The first one says, "Not all superheroes fly, some just donate." And the second one just tells them that you can be one step closer to saving a life. So yeah, these are just a few posters. Coming to the challenges that we currently face and that probably India at large faces. So as I mentioned earlier, the fear and stigma surrounding plasma donation. I keep stressing on this because there is a lot of fear. Fear, why? Because donors get scared that if they go to a hospital, they might get reinfected with the COVID-19 disease, which in reality is not the case given that antibodies last for a span of 3 to 4 months, which means that they won't be reinfected till the time that they do have antibodies. So we're trying to reduce that fear. And when it comes to stigma, as I said, people earlier, a lot of people are don't want many other people to know that they suffer from COVID-19, or there are these many challenges in people's minds about donating, which we're kind of trying to reduce, and we successfully have been able to reduce. And from what we realize, it's only through collaborative efforts from many different partners like doctors, like healthcare organizations, that people actually change their perception of plasma donation. Secondly is the stringent eligibility criteria. Now, this is very important. If we're comparing the US and the India, now in our eligibility criteria, pregnant women or women who've ever been pregnant are not allowed to donate. And as mentioned in the presentation earlier, that's because they develop antibodies against the antigens in the baby's genetic material. However, that those antibodies cause a side effect called transfusion related acute lung injury in less than 0.1 or less than 1% of the patients. So in the US, they've realized since there's a very low rate of side effects due to pregnancy, they've kind of allowed pregnant women to come forward and donate as well, which in India, that's not currently allowed. So this is one challenge because a lot of recovered COVID patients have been mothers or have been pregnant in their lifetime, and that kind of reduces a lot of the population that can come forward to donate. So pregnancy is one of the stringent eligibility criteria. Secondly is in India, they require 28 days. A lot of hospitals require 28 days from symptom recovery. Whereas if we're taking the US, for example, they require a period of 14 days. So the 28 days is a long gap between for recovery. And if the government possibly changes their guidelines tomorrow, that also be really effective in bringing more donors to come forward. Thirdly is COVID reports. Now, a lot of donors do not have COVID negative reports. Once they've recovered, they've not got a COVID report because their symptoms have resolved. They don't feel the need to get a negative report done. And a lot of hospitals require that COVID negative report to make them eligible for plasma donation. And that's something that doesn't exist in the US. I'm just comparing the US because they do the most plasma therapy. And in the US, they don't require COVID negative report. They only require COVID positive report to say that you have had COVID at one point in your life. So these are a few kind of criteria that have become very stringent and become hard for a donor to be eligible in the process. Another one is the hemoglobin levels. So a lot of women in India are anemic, and the ICMR has currently set the level at 12.5 grams of hemoglobin needed to donate, which is a little high. And a lot of women don't have that 12.5 gram hemoglobin level, which becomes hard because sometimes they're very keen to donate and they go and the levels come maybe between 12 to 12.5, and the hospitals don't allow it because they personally don't want to deviate from the guidelines. So that's a very high hemoglobin level set for the guideline, which could possibly be altered on a high level. Third is lack of plasma collection facilities. This is slowly changing. Now, in the beginning of the pandemic, many hospitals didn't have an apheresis machine. There were not many plasma banks set up. People didn't know where they could go to donate plasma. There was probably only one hospital in each city where they could donate plasma. But now that's changing, and that's a great news and a sign of hope, is that the government personally has set up 3 plasma banks in Delhi, Hyderabad, and one coming up in Mumbai as well, and even in Bangalore. And also a lot of hospitals now have apheresis machines and have kind of adapted really well. And they've learned how to use the apheresis machines better. So that's been a promising change. Last challenge is the access to database. Now, being a sensitive topic for hospitals and the government at large, COVID-19 patient information is very confidential. And so in Hyderabad and Delhi, we've been able to get, lists of recovered patients who've recovered from COVID, and we've been able to reach out them and encourage them to donate. But a lot of hospitals do not want to reveal this information for obvious reasons. So it's been really hard to reach out to these recovered patients who might be encouraged to donate. So that's another challenge. And if we can actually get more lists of patients who have recovered and encourage more people to donate, that would really be effective in generating a larger donor base. Coming to what we need and what we're looking for. So the first and most obvious thing is we're looking for more recovered COVID-19 patients to come forward and donate. As I said, there's a huge imbalance, and we're trying our best to find as many donors and help, which would eventually help as many patients. Second is we're looking to spread awareness among the general population to reduce the fear and stigma that surrounds plasma donation. When everyone around you is talking about plasma and the benefits of plasma and how it saves a patient's life, donors automatically get encouraged to donate. So that's spreading awareness in the general population is very important. And third is we're looking to spread awareness among the families of patients so they can register as soon as possible and we can get them matched with a donor as soon as possible. So that's sort of what we're looking for. And so this was the end of the presentation. I'd like to thank everyone. This is just the last poster encouraging people to join the fight with us against COVID-19 and help save a life. So these are just some graphics that we've been circulating to encourage donors to come forward and donate. I'd just like to share a short video, if that's okay, made by the Rotary Club of Hyderabad. They made a short video for us, which to encourage people to just spread awareness about plasma donation. So I'm just going to quickly share that. Just a second.
Rotary Club of Hyderabad East.
Just want to know if y'all can hear the audio as well.
Yes, sir, we can hear.
Yeah, we can hear.
Okay, great.
Partnering with PINT networks to spread awareness about plasma therapy and help find COVID recovered patients who are willing to donate plasma to save lives of critical COVID patients.
So far, we don't have any vaccine or any antiviral drug for COVID-19. While the search for them is on, a treatment called plasma therapy has received a lot of attention. But what is plasma therapy? And how does it work? When any harmful bacteria or a virus like SARS-CoV-2 enters our body tries to destroy it, thanks to our immune system. There are different kinds of warriors inside our body, and among them are the antibodies. Our body generates a specific antibody to fight a particular invader. Like, the antibody for COVID-19 will be different from the antibody for the Ebola virus. Being specific in nature, antibodies are very effective in fighting viruses like coronavirus. But our body takes time to release these antibodies, and hence, the virus may get enough time to take over and spread itself more, and the person's health becomes worse. What if we take antibodies from the recovered patient, whose body has already produced them to fight the virus, and give it to an ill patient whose body is unable to do so in time? That's what plasma therapy is all about. It is an age-old method in which transfer of antibodies is done by the transfer of plasma. Plasma is a constituent of blood which accounts for 55% of the whole blood in our body. Rest 45% is made up of the red blood cells, white blood cells, platelets, etc. The plasma is made up of water, salts, enzymes, proteins, and our savior, antibodies. If a COVID-19 recovered patient donates their plasma and it is transfused into a critically ill COVID-19 patient, the donated antibodies will start targeting and fighting the virus. Here is how it is done. The process of donating plasma is similar to blood donation, but in this method, plasma is extracted from the blood and the remaining cells are returned to the donor's body. The process of extracting plasma from the blood is known as plasmapheresis. The blood group of the donor is matched with the blood group of the receiver, and it is also checked that the plasma of the donor has a sufficient amount of antibodies in it. A donor can donate plasma even twice a week, unlike the proper blood donation, which is once in 3 months. A single donor can donate 400 ml of plasma at a time. 200 ml is sufficient to treat one COVID-19 patient. Hence, plasma donated by a single person who has recovered from COVID-19 can help 2 people to recover. But is plasma therapy better than a vaccine? Plasma therapy is a preventive measure and is used for critically ill patients only. It provides passive immunization, unlike vaccine. When a vaccine against a particular infection is given to a person, the immune system starts producing specific antibodies. These antibodies leave a memory in the cells to fight any future infection. On a later date, when the vaccinated person is infected by the actual germ or virus, the immune system neutralizes the infection by releasing the required antibodies. While the vaccine provides such lifelong immunity, the effect of plasma therapy lasts only till the antibodies ingested into the infected person remain in their bloodstream. Therefore, the protection given by the plasma therapy is only temporary. So, plasma therapy does not seem to be a foolproof therapy, but nevertheless, it has helped in treating some of the critically ill COVID-19 patients across the globe.
If you are or know any COVID recovered patient who is willingly ready to donate plasma and save others' lives, please register on pintnetwork.com.
Yeah, sorry, that was just a short video made by one of our volunteer organizations in Hyderabad. But with that, I end my session and would love to answer any questions. So thank you for that.
Thank you so much, sir, for your wonderful presentation and the informations you have gave. That video was awesome. We are very highly obliged that what the work you're doing, and we wanted to wish you very all the best for the work that you are helping to provide the plasma for the patients. So we have different questions from the people, from the medical students, that is it safe to donate the plasma and is it effective in this COVID-19 situation?
Yeah. Let's talk about the safety and effectiveness. So safety wise for the patient, there has been a study in the US by the National Expanded Access Program that is looked over by the FDA, where they've infused 20,000 plus patients now with plasma, and they found the adverse events to be less than 1%. Now, with any treatment, when adverse events are less than 1%, that is a very promising treatment. So similarly with plasma, they found the adverse events in over 20,000 patients to be less than 1%. So they found, yes, it is very safe to give convalescent plasma. However, effectiveness is something that has not been determined. There's a lot of controversy about effectiveness. And there have been, in the beginning of the pandemic, a lot of the trials that were done were only case trials and control trials. In a sense, they were done only 20, 30 patients. However, in the US, the plasma just received FDA approval based on the 20,000 patient trial conducted by the Mayo Clinic. And in this, they found that giving plasma in the early part of in the first 3 to 4 days was more effective than giving it later on in the disease. And secondly is they found giving plasma with a higher titer of antibodies is more effective than giving it with a lower antibody titer. Naturally, higher antibody titers work. However, they've not established a proven mortality benefit, which is really hard for any treatment to establish right now. They do find that it's preventing progression to severe disease. So when regards to effectiveness, it is still to be determined. But currently, doctors are using a whole army of treatments, right, from favipiravir to remdesivir to plasma. So it's definitely an add-on treatment and definitely something that could help patients.
So we have one more questions from our medical student. Her name is Shruti Shankar. She wanted to know that if the recipient has any side effect due to donor plasma, are there any guidelines in your organization to protect the donors?
No. So currently we have a terms and condition that states that we're not, neither us or the donor or the patient is liable for any complications in the donation process. So what we only are a facilitator in a sense that we only help patients to find donors. The actual donation process is carried out by hospitals and blood banks, and they do the actual screening in a sense that they do the actual testing and they do the actual collection process. It would be up to them to ascertain all the safety criteria. There's only so much we can do, virtually and kind of being remotely helping people.
People also ask that people didn't got COVID infection, so they're not infected with COVID. So what can the other people can do more regarding this?
Definitely, that's a great question. So there are two things. One is if they are keen to donate. Currently, what's happening in a lot of hospitals across India is that due to the lockdown, a lot of the blood donation camps that generally are organized on a monthly basis have not been able to be carried out. And this causes a huge shortage of blood. Besides plasma, there's a huge shortage of blood in the COVID-19 pandemic due to the fact that people don't want to go to a hospital to donate blood, and there are not enough blood donation drives carried out. So if you aren't a COVID patient or you've not recovered from COVID, what you most certainly can do is donate blood at a hospital. It would be really effective for people, for children suffering from bleeding disorders or people with cancers who need blood. Secondly is through your own personal network. If you have family members who've recovered from COVID, if you have friends who've recovered from COVID, if you know anyone who's recovered from COVID, kind of reaching out to them and encouraging them to donate is the most effective thing. From what we've realized, a lot of encouraging happens on a personal level. Like tomorrow, if my family member gets COVID and I tell him to donate plasma, he's much more willing to versus an organization or versus a news channel telling him to donate plasma. So from a personal basis, if you can encourage someone to donate and refer them to the website, that would be really helpful.
So we have another question from Sashank. So they wanted to ask, sir, what do you think should be approached to encourage more people to donate plasma? And he also writes that we are having a recovery more than 90K every day, but we are not able to see many donors. So what are the reasons regarding that?
So as I mentioned earlier, there's a lot of fear about getting reinfected with COVID. The scenario is that once a person has antibodies, those antibodies last for a period of 4 to 5 months, 3 to 4 months minimum. So they need to be aware that once they have the antibodies, they won't get reinfected by going to a hospital. Secondly is to actually put them in touch with the patient in need. So what I've realized is when donors actually connect with the patient in need, their willingness increases tenfold when they actually hear the families of patients struggling, and when they actually go through the process, because they've also gone through the process of COVID. They know how it feels. So when they actually connect with the patient, it's really heartwarming to the donor as well to actually be able to help out in any way they can. So that's another thing. Thirdly is a few donors have concerns about getting some infections through the plasma process, as in through the machine. But I just want to specify that for each and every plasma collection process, a different set of discarded items is used, and it's sanitized for every donation. So there's no chance of infection spread through the actual plasma collection process. Just awareness, just telling them how they can save a life, just putting them in touch with people who need plasma, that becomes very effective.
All right. Ma'am, Suja ma'am, if you are here, there are a few questions directed towards you as well. Now we'll just be taking questions from the audience. So if you guys have any questions, please drop them in the comments. Ma'am, so we have a question saying that if a person has recovered from COVID and has an autoimmune disease like SLE, can that person donate plasma?
Definitely not.
And ma'am, this question is directed towards you. ICMR has stated that plasma therapy is not useful for COVID patients. What is your take on this?
Yes, as I said earlier, there have been lots of studies have been undertaken and still going on regarding. So it depends again on patient parameters and the clinician decision, like who should benefit, who will benefit, who will not. So we can't definitely say that it is one extremely good mode of therapy now. Still, there are studies to be done, but it can be an adjunct to other modalities also. So definitely you're going in for all the antivirals, etc., etc. And again, till the vaccine comes up, this can be taken in as one mode. That is all. There's still a lot of studies going on regarding the 100% effectiveness of the plasma therapy.
Yeah, just to add on to that, just a concern. So in the ICMR results, what they found was it doesn't show mortality benefit, and they didn't find progression to severe disease changing. But what they did find was they did see a decrease in breathlessness as well as improvement in oxygen saturation in patients giving plasma. So as rightly mentioned by Dr. Suja, there are many different parameters to look at in a trial as well. And mortality benefit is always in the news, but that's something very hard to show in COVID-19 because we still don't know which patients are going to progress and which patients get bad. There are a lot of factors to take into account. So yes, I mean, we should definitely not rule out this treatment based on just one trial result.
All right. So for how long can a recovered patient donate his plasma? Like how many months?
Okay, as I said, the antibodies will remain for some time, but I don't think we'll be, still now we don't know because we usually get only 1 or 2 donations till now. We can't tell for how long. All that I don't think we can exactly predict for how long it will be useful. The immunoglobulins will be there in the person, but again, the strain changes can happen. So if that happens, this antibodies will no longer be useful. So as Dr. Neil Pinto said, it's difficult to get donors at this stage. So we can't definitely predict for how long they can donate to be useful with antibodies as such.
Okay. So what is the treatment for pregnant women who have severe ARDS because they are contraindicated for plasma therapy? How are they treated?
Yeah, I think there are the antivirals and the mechanical ventilator support and all that is there for the pregnant women. So this is the only thing which is contraindicated, whereas they have to go ahead with the other modalities of treatment. As you said, this is again an adjunct. It is not that it is the mode of treatment. So it's just an adjunct to other thing which can be tried in people. So definitely we have to look out for other modalities which can help a pregnant.
All right. So Dr. Neil, we have people asking for the link to your website and the video that you shared. So if you can share it with us, we will send it over to them on their WhatsApp group.
Sure, great. The website is called pintnetwork.com. And our Instagram handle is the same. As for the video that I showed, that I will share with you all, that's actually made by the Rotaract Club of Hyderabad who've been helping us. They've made a video and they've shared it on the Instagram as well. So I will attach the link to that on the YouTube page.
Okay. So what is the treatment for RH incompatibility in administration? So when we give immunoglobulins, won't they be susceptible to reinfection?
Yeah, I saw the question, but it doesn't, I don't know, it's not correlating well. RH incompatibility is totally different issue. In that you give immunoglobulin injections, which are prepared. As I said, it's prepared from pooled plasma. Those are immunoglobulin injections. That's totally different. And I didn't understand what about the reinfection in that part. The question was not a little clear, actually. I didn't get it.
Okay, so the one who commented, if you can rephrase the question and put it up, we'll take the question again. So what is the minimum age to donate blood? Or
18 years.
okay. So if any hospital is denying to give information of a COVID recovered patients, you can just use paper you can give a paper to the hospital so that it can be attached to the application of the patient through which they can take the consent. There's a comment by Sharat Chandra Ponara.
Yes, definitely. That's something we're working on actually, of making a flyer just to, when a patient is discharged, just to make them aware that they can donate. Many people who've been discharged don't know that there's something called plasma donation. So we're planning to maybe give them a small flyer or paper during discharge to tell them that there is an organization that can facilitate the donation process if they were interested.
I see a lot of questions regarding how long we can donate plasma. So, is there any test that we can use to detect the antibody titers
Yeah, that's
in the body?
yeah. As already said, the ELISA, no? We do the ELISA titers have to be done. So it has to qualify. The 1:640 titer should be there. So once we know that it's not in that level, then maybe it's no point in donating. That's why the cutoff has been kept there. So as I said, we can do the titers and then check out.
So, ma'am, do the titers test neutralizing antibodies only, or do they test other antibodies as well, even the
It is
surface
testing.
antibodies?
It's against the S protein, spike protein. So it's a neutralizing antibody. Yes.
All right. If there are any more questions, then please do type it in the chat.
Yeah, one thing I just like to add, like Dr. Neil Pinto said, there is a vast shortage of blood in the present pandemic. As he said, it's very difficult to get donors. We in the blood bank, we have been experiencing acute shortage. So just maintaining a bare minimum, we are requesting people to come ahead, come forward and donate. We are not able to conduct camps that has been ruled out at this stage. So they have to come voluntarily and give blood. So as Dr. Neil said, other than plasma, there's a general shortage of blood donation other than that also. So I would request volunteers, definitely there's no harm in coming forward. And we maintain all strict precautions, and the blood bank, there's no exposure to any patients there. So most of the blood banks will be totally separate. You don't get any exposure to the patients. So definitely following all the precautions, volunteers can come forward to donate.
So we have a question saying, ma'am, in a hospital level, is the Department of IHPT consulting the discharged patients individually and counseling them using the help of the psychiatry department or so?
No, at present we are not doing that. We are not started doing plasma therapy in our center. So in our center we are not doing that at present.
So we got a question now from Manoja Kumari. So she wanted to ask, like, a patient recovered from COVID 3 months ago. Can they donate plasma now? Is it possible for them?
Yeah, they definitely can donate plasma, but as mentioned earlier, an antibody test would needed to be done. If the antibodies are above the required titer, then most definitely, hopefully, they should have antibodies after 3 months.
And I'm also getting a lot of messages like, I stay in a remote place, but I'm not able to get the plasma in whenever I need. So if anyone wants to get the plasma, so what is the procedure and like how they can get the plasma as soon as possible?
Yeah, so that is a very intricate question in a sense that different hospitals across India have different protocols. Now, some hospitals do not require plasma to be taken from outside blood banks, whereas some hospitals allow. So, first is if a patient is in a remote hospital, we need to see if the hospital allows plasma to be used from an outside blood bank. Secondly, if we need to see if the hospital themselves have a plasma machine, a lot of the hospitals don't have a plasma machine. So either they take it from outside or they kind of collect blood and then separate the blood later on in the process. But in most of the times, the donor can either go to a local blood bank or to the hospital of the patient. These are the only two places where they possibly can donate.
People also want to ask, like, how effective this plasma therapy is there, like, as compared to the normal mode of treatment, alternative modes.
Yeah, I think that has been answered recently. It has been a few of the answers we have been making it clear that it's just an adjunct to the other modes, and still there are trials going on. Some patients' benefits may be there, they seem to improve, but some may not. So it's too early to say whether it can be only mode of treatment.
We have another question. Where can a physician obtain convalescent plasma for a patient with a COVID-19?
It's either the hospital or the local blood banks. I don't think there's any other place where plasma is, scheduled out. And in Delhi, there's a plasma bank. And in Hyderabad also now they have a plasma bank, but not all cities have a plasma bank. So it's either the hospital themselves or the local blood bank. that they could get it from.
Okay, I don't really see any questions coming up right now. Okay. If suppose there is a COVID-19 recovered patient and they donated plasma, how many patients are benefited by one donation and how frequently can they donate plasma?
Yeah, I think same. We have already said the initial dosage is around 200 ml, and further dosages depending on the patient's status, the recovery, and whether he needs more. So definitely at one sitting they'll be taking 600 ml, 500 to 600 ml. So it will definitely go for 2 patients. And again, how many times you can donate is depending on the antibody titers. So this has to, it's a must to check the antibody titers. Otherwise, no point in donating the plasma and giving it to them.
Yeah, just an ICMR guideline to add on. They said that a donor can donate every 14 days, which means that he can donate twice every month maximum, not more than twice a month.
All right. So there's a question asking, is weight above 45 kgs a compulsory criteria for plasma donation, or can we use any other criteria as well?
It is a compulsory criteria for any blood donation as such, because your body fluid, the amount of fluid that you have in your body is dependent on your weight. So that's why the criteria has been kept. So any person above 45 kgs only can donate. Otherwise, the donor will have serious consequences once you withdraw all the fluid from the body.
Ma'am, can we not use a body mass index or other indices to check if the plasma, if they can donate plasma?
At present, this is there's a guidelines that has been set up, so we have to stick on to that 45 kgs weight only.
Ma'am, when we're injecting antibodies, won't they act as an antigen in the patient? Won't they act as a foreign particle in the patient?
When you're giving the antibodies, yes, that's why we are seeing reactions. That's why we said people are sometimes hypersensitive to the products. So anywhere this immunohematology is totally concerned about antigen antibody reaction. So we don't know which, sometimes if the person has any antibodies to the particular parts, then they can. That's why we say you should not give in IgA deficiency, because IgA deficient person has got IgA antibodies. So reactions can happen.
So I got a question to Neil, sir. So people started asking like how much they need to pay, like if a person is donating or if a person is receiving the plasma from like any government institute or somewhere else. So how much is the money criteria?
Yeah, so we as an organization don't promote or facilitate any monetary incentives. It's completely free of charge to find a donor or match a patient and donor from our organization. If a patient had to get plasma at a hospital, now that varies. Different hospitals charge different amounts for plasma, but I believe it is between 10 and 20,000 for 1 pint of plasma. That's 1 transfusion of plasma. But again, it varies. So you have blood banks that charge under 10,000. You have hospitals that probably charge 10 to 20 or sometimes even more. But from our side as an organization, we are a non-profit, non-governmental organization. So we do everything free of charge.
Okay. Okay. So what type of medical screening and testing is done before donating plasma?
Yeah, the medical, the basic screening would be the systems, the cardiovascular system, or that is screening the pulse, the BP of the donor is taken. And the other screening that we have already said is for the transfusion transmissible diseases, the complete blood count is done. So the person has to qualify all for all these criteria, only then he'll be eligible for donation.
We got one more question to ma'am. So it's from Harshita. So she wanted to ask, when we give IG to a mother with RH incompatibility, we are essentially preventing the production of IG. So when we give the plasma, won't the COVID patient be more susceptible to reinfections compared to those who recover from the plasma therapy?
Actually, it is a little confusing this because both are different. See, IG is because of exposure in the during pregnancy. The RH incompatibility happens during pregnancy because of exposure to the immunoglobulins in the baby, and the person is already getting immunized to that. That's where the reaction happens there. So I don't think that can cross react here in any way. I don't think that is because it's not IG deficiency. In a person who is IgA deficient, as we said, they will have the IgA antibodies, but that's not the case here. This is a totally different entity. These antibodies, we give the immunoglobulin and we destroy all the antigens that have come in. So that is a mechanism that happens in RH incompatibility. I don't think that will be interacting with the plasma therapy at all.
All right. Any more questions, guys? We still have time to take a few more questions. Or any other comments that you would like to share? Okay, so we have a question. Can a patient of hypothyroidism donate blood or plasma? Because one possible pathology of hypothyroidism is antithyroid antibody.
Yes, we usually discourage from hypothyroid patients, donors. We usually discourage. It's not advisable to donate.
So we have a similar questions related to this, ma'am. So the question is, can a diabetic patient can also donate plasma?
Diabetic patients, we usually defer them.
Okay.
All right. So there's a question. Why is it possible for us to donate plasma more frequently than it is to donate blood?
Yeah, this is a different mechanism. We are talking of plasmapheresis, where regular blood donation is totally different. That's not pheresis. We take our blood back and we separate it into the components. That is what happens in your regular blood donation. Whereas pheresis as such is a totally different procedure where we take the required components and return back the rest of the elements to the donor. So in that, you don't need to have such a big interval there. Whereas in the regular, you need to have at least 3 months interval before you can donate because you've taken out 450 ml at a time. Whereas in pheresis, we take whatever we want and the rest of it is returned back together saline. There's not much of fluid loss and the cells are again replaced. Whereas we need time for the cells to regenerate when we take out 450 ml at a time. That is why we need to have a interval of at least 3 months in regular blood donation.
Yeah, just to add on to that, so RBC takes as we 120 days. We learned it in our first 1 or 2 years of medicine, 120 days to regenerate. So for blood donation, since the RBCs are also taken, they require 3 months for that regeneration. Whereas in plasma, the RBCs are returned back to the body. So there's no loss of cells. There's only the liquid part of the blood taken.
So we have another question. How long does it take to donate a plasma? Like in the first time and the second time? So it is the same like the first time when we are donating the plasma, or the time differs?
It's the same. Both the times it's the same, but the screening and all that, it takes almost to 2 hours, the whole procedure as such, because we need to screen and all that. The results have to come. The titers have to, with the titers, if the report is ready, it's fine, but we do need to do the initial screening, all that. And the procedure as such, depending on the other, like the patient's weight and the body volume that he has. So the procedure of only taking out plasma as such will take around 30 to 45 minutes. So on the whole, they'll need to spend around 1 to 2 hours when they come to the center. It will be the same both the times. First or second time, it will be the same.
In plasma therapy, within how much time is the plasma transfused?
As I already said, it's frozen. The plasma is in a frozen state. It's preserved in a frozen state, and it has to be thawed. It has to be put in water bath at 37 degrees centigrade before it is issued. So once it is thawed, it cannot be refrozen and it has to be used within 24 hours. So it has the best is to use it immediately.
All right. Any other? So just a reminder to everybody, those of you who are SIMSA members, you are eligible to get a certificate for attending this event. You will have to fill the post-event questionnaire at the end of the session. And please stay in the WhatsApp groups because we will be distributing the certificates on the WhatsApp groups itself. And also at the end of the session, we will be sharing a feedback form. The feedback form, again, I repeat, it is anonymous and I promise it won't take you more than 2 minutes to fill it up. We just want to know what you thought of the session and if it was effective or not.
So here we got a question to Neil, sir. So what documents should donors give for donating plasma? So there are specific requirement documents.
Yeah, so we as an organization don't take any documents, but the blood bank or the hospital where they're going to donate would require documents. They would require just the COVID positive report, that is the RT-PCR test report. That they don't accept just a doctor's prescription saying that you have COVID. They require an RT-PCR report. And also they require a RT-PCR negative report. So just your 2 COVID test reports, one for positive and one for negative. Also, if you don't have a COVID negative report, at times the patient's family can get a COVID report done for you to ascertain that you're negative, in case the donor does not have a COVID negative report.
So is there any criteria that a symptomatic patient or a asymptomatic patient can donate? Or either can donate?
No, either can donate. I've got this question a lot actually from a lot of people, but it primarily depends on your antibody titer. It does not depend on whether you are symptomatic or asymptomatic. But however, they do find that people who have a more severe form of the disease tend to have a higher antibody titer. This is not a hard and fast rule, but it's just something that doctors have seen when they get donors, etc.
Yeah, I think that was earlier mentioned also. Symptomatic patients are better because antibody titers will be more in them rather than the asymptomatic patients. So mild symptoms, even cough, at least fever and cough would be helpful in bringing up the antibody titers. And finally, it is only the antibody titers which are determining.
Okay, I think for some reason we have a lot of questions regarding pregnant women receiving plasma. So, ma'am, from what I've understood, pregnant women are not eligible to receive plasma therapy, right?
Yes.
Ma'am, can you please explain to us once more why pregnant women cannot receive plasma therapy? Because I think we have 4 questions related to that, and everybody is asking why we can use it or why we cannot use it.
Yeah, actually, pregnancy is a condition where the lady gets exposed to foreign antigens from the fetus. It's one case where there is a mix of antigens that is happening. The fetus will contain both antigens from the father's side and the mother's side. So the lady gets exposed to new antigens during pregnancy. And definitely these antigens, when they enter into during delivery, there will be many of the antigens which will be crossing the placenta. It will enter into the woman and there will be development of antibodies there. So it is a condition where there are new antigens also present, lot of antibodies present in the lady. So when you give this plasma, as I already said, it is a storehouse of proteins. There are a lot of antigens, antibodies all present in the plasma. So there is a lot of chance, there's a chance of reaction that can happen. We cannot predict exactly what can happen. That's why we say the pregnant women should not be taking the plasma therapy. As I said, there are a lot of proteins and there is always reactions are happening because of the antigen antibody stimulation that is happening. So that's why we say pregnant women are not a target for the plasma therapy.
Okay, so before we donate our plasma, we will obviously be checking the antibody titers, right? So, is it possible that because of a false positive test due to negligence of a lab technicians, what if a person is it possible that a person receives plasma from such from such an incident?
Yeah, actually, there are two types of tests for the antibody levels. One is the quantitative, the other is the qualitative, where you just, in the qualitative, you just say yes or no, antibodies present or not. But now the clinicians are insisting you should have the titer level. That's why we insist on the titer, which is coming on automated machines. So it's very difficult to get a negative in that. Yes, the qualitative can be false positive or false negatives can happen. So that's why we insist on the titer especially. So which it definitely comes from the machine. So mistakes happening is very less in the quantitative. So we insist on the quantitative levels titers, not the qualitative ones.
Okay, I am reading a question by Hashwita, but I'm not sure I understand your question. She says, what happens if a person has had a plasma transfusion because of a false positive test? Here, the patient is asymptomatic and the test is false positive. Will the antibodies act as a memory cell?
It's just to ask whether the cells, we have already said the immunoglobulin is the passive, this is passive immunity. They don't remain for a long as you contrast to your active immunity where it is lifelong. So I think they will not be remaining for and they will not confer immunity lifelong, even if you get the passive immunity. I think that answers that.
Okay, so by receiving the antibodies, the patients are getting a passive immunity. Whereas if you have been infected, then you will have you would have developed an active immunity, and your body will then produce memory cells, and that will help you, probably produce antibodies if you are reinfected. But if you're receiving the antibodies, then it is just a passive immunity and you do not develop memory cells. I just reiterated this in case there are any first years who have not yet done immunology completely. All right. So there is, does reinfusion affect the half-life of cellular components?
I didn't get that.
Ma'am, so once, I think what they're trying to say is once you return the components, like once you remove the plasma from the body during apheresis, and then you return the components, do the cellular, does it affect the half-life of the cellular components?
No.
So there's a question to Neil, sir. So Kai asks, like, if there's any emergency occurred sometime, so how will you address this situation? How fast you can provide the plasma you need?
Yeah, that's a great question. We kind of deal with every patient on an emergency basis. But as I said, there's a huge imbalance between the donors and the patients. So if we have a donor, we immediately provide them the details. So as soon as the patient registers and we have a donor, they would get it not even within an hour, they would get it within a few minutes. However, the problem arises when we don't have a donor. Then we try our best to obviously find another donor. But if we can't find that, we provide them other sources where they can possibly find a donor, like various other organizations or other hospitals where they might have a chance of finding a donor. So that's all we do from our side, and we try to kind of help them in as many ways as possible.
So what are the precaution measures can be taken before donating the plasma?
As Dr. Suja said earlier, I think avoid alcohol and smoking 24 to 48 hours before plasma donation. And of course, keeping yourself well hydrated would be important for plasma donation. And just to tell your doctor, tell the hospital if you're any medications like aspirin or any blood thinners. That also, many heart patients are on aspirin, etc. So just telling your doctor if you've had a surgery, or if you have a tattoo, or if you on any medications, that could be some of the things that you can do before donation. But otherwise, there's not much you need to be worried about.
I got another question. Does the patient need to be stay in hospital after once the plasma therapy is done? If yes, how long?
I think the patient is already in the hospital on treatment, so it all depends on the other factors like improvement or whatever. That is the call taken by the clinician, so it doesn't depend on the plasma therapy at all.
Ma'am, if the plasma donation is done frequently, is there any chance for getting side effects?
There should be no side effects, but the thing is, as we said, you should be taking plenty of fluids and keeping yourself hydrated and avoid all those heavy weightlifting. That's for some time. Other than that, there is no side effects as such because of the donation that can happen. Because the fluid will be regenerated, whatever is taken will be regenerated within some time. So donation absolutely has no side effects as such.
Is there any chance of reinfection in a patient who is treated by plasma therapy as he or she is getting passive immunity?
Again, as I said, reinfection, there can be a different strain also coming in. The strain can keep varying, mutations can keep happening, and you can get reinfection with a separate strain. In that case, definitely you'll have a reinfection because the antibodies will be only against one specific strain.
Can a person who has tattoos donate plasma?
See, regular blood donation also we defer people with tattoos because there is an increased chance of transfusion transmissible diseases coming in, needle injuries. So that is a totally no for any regular blood donation also. So same applies for plasma also.
Ma'am, so the question that I had asked just before, they were saying that is there a chance of reinfection in a patient who is treated by plasma therapy by the same strain because he is receiving passive immunity?
See, the person already.
Can he get reinfected?
Yeah, the person also has developed active immunity also. It's not just only the passive immunity. So the active immunity will also be there. So there's a less chance of reinfection of the same strain.
So, ma'am, suppose somebody who has got a couple of tattoos on their body and they want to donate plasma, is it possible for them to get screened or tested for all the transmissible diseases? And then if they come out negative, can they then donate?
Usually that is a deferral point. We don't encourage people with tattoos. That is a no, definitely a no. We don't proceed to the screening. That is our criteria.
All right. So what about people who have recently had any piercings, perhaps ear piercings, nose piercings, or any other body piercings? Can they donate?
Single piercing is fine. That is not an issue. Ear piercing and all is fine. That's not an issue.
We have another question, ma'am. As the plasma is rich in many other proteins other than antibodies, is there any procedure done today and filtered out the non-essential components for the therapy to minimize the reaction?
No, we are using the proteins. So what do you want to filter out? Like it's basically for the proteins that we are taking. The other thing is like separation. As I said, they pool the plasma and do the fractionation and take out the albumin, whichever one you want, the albumin, globulin. So that is a different procedure. So this we are talking about, we are using the proteins here. So we can't filter out as such. There are no such filters where you can separate as different proteins.
All right. Okay. So we have time for just a few more questions and then we will be wrapping up. If anyone has anything or any comments you would like to add, please do type it in the comment section of the YouTube video. All right. I don't see any questions or any comments coming up right now. Abhishek, do you have any other questions?
Yeah, so there's a question. Should their screens should be done for HBsAg antigen? So there's a
Yes.
specific screening required. Yeah.
Yes, it is required because it is one of the diseases which are transmitted through blood. So whatever diseases are transmitted through blood have to be screened. Whereas other hepatitis B and C are the ones which are transmitted through blood, whereas A and D are not. So we do the specific screening only for B and C.
Yeah, the three major screenings done are: one is the antibody test, one is the CBC test, that is the complete blood count to see if your hemoglobin levels, your WBC levels are on point, and last is the Triple H test, which is the HIV hepatitis test, which is done. So these are the three major screening tests that are done in hospitals to a certain eligibility.
Ma'am, are all the diseases that are transmitted by blood also transmitted by plasma, or are there any exceptions?
Same.
They're all the same.
Yeah, they're all the same.
So just a reminder again that if you are a SIMSA member, please do wait till the end of the session. We'll be sending in the post-event questionnaire and the feedback form. The feedback form can be filled by absolutely anybody, of course, but the post-event questionnaire is mainly to assess how effective the event was and if you have learned anything today. Okay. So since all of us gathered here are medical students, medical students are the ones who play a major role in spreading awareness. And hopefully now, with the knowledge that you've gained during the session, you will be able to spread awareness to at least a few of your friends, to your family members, and keep the chain building. Initiatives like, I think, a PINT are very, very important, because whenever I get a message saying that, okay, I really need plasma, I am frantic and I don't know where to go, I just have to start sending it to different WhatsApp groups, and my family group, maybe they know someone, maybe my friends group, maybe they know someone. But a network like this, I feel, is really, really helpful. And the more we help expand networks like this, the more people are going to be benefited with plasma. Right now, we are in a place where there are still a lot of ongoing studies, and there are obviously a lot of questions about whether plasma is effective or not. Nevertheless, this is still a treatment modality we are using, and it is effective for some people. There is a reason why we're still using it. We don't have a choice until, I think, we come up with a more, a rigid process or a perfect vaccine. Okay. So any other last comments or last statements, Dr. Sudha ma'am or Dr. Neil Pinto?
Yeah, I would like to thank again SIMSA and especially Swati for all the initiative, the great initiative and the coordination, the cooperation. It's been a great event. And Dr. Neil Pinto, thank you so much. That was a really good presentation from your side. And keep up the good work that you're doing. Thanks all.
Yeah, I mean, same from this side. I'd like to thank everyone, Dr. Suja, for the wonderful presentation and the expert knowledge from the field, as well as the SIMSA team to actually carry out this initiative. It was a very great initiative, and I hope we can continue this. I feel that, I mean, it's only through collaborative action and collective action that we can get over this pandemic. And I truly feel that, we being healthcare professionals and medical volunteers, it's up to us to kind of build this strong base that we need. The nation kind of needs to rely on us. So I truly believe it's this youth-led initiative and through the healthcare professionals and medical volunteers that we can make a difference. And I look forward to any impact that we can have and to help as many patients as we can.
Thank you so much to both our speakers for joining us. It has been a delightful session. I've learned so much through this session, and I'm sure the audience also finds it very informative. We will be keeping this video live for another couple of hours. So if you want to rewatch, revisit the lecture, if you want to take down any notes, then go ahead, and the link will still be on for some more time. All right. Okay. So we have a last minute question. So if a person recently gets got vaccinated, can he or she donate plasma?
This is a general deferral for any blood donation, like vaccination. Recent with live vaccines, we usually do not encourage donation there. They have to defer for at least 2 months for that.
Okay, so there's a question saying, can a HIV positive father, but their mother and children are negative for HIV, can their children donate plasma?
Children meaning, okay. Sorry, can you come again?
So there's a HIV positive father, but the mother and children are negative for HIV. So can the children donate their blood or plasma?
I think we would be deferring that. Maybe it's not advisable.
All right, guys. So we come to the end of today's session. It is 1 p.m. Okay. Thank you so much to everybody for joining us. If you have any more questions or any more queries that you would like answered, do drop it into the WhatsApp group. We will be happy to forward it to both our speakers the relevant questions, and we will get back to you on it. Again, we will be sharing the PPT with you on the group, so don't worry about the PPT. But if you do want to take notes from the lecture, again, rewind the video and watch it. It will be on for some time. And log on to PINT network and register yourselves. Okay, even if you are not COVID positive, it is perfectly all right. Spreading awareness, I think, is really, really important. That's how we can get the word out to people who actually are in need, but they don't know about the initiative. And who better to do it than medical students? Am I right?
Yes.
Yes.
All right. Thank you so much for joining us.
Thank you.
Okay.
Thank you.
Bye.
Bye-bye.
Have a good day. See you.
Have a good day.